I'm Mariela Gonzalez with your WebXtra. I'm here at Cline Family Medicine with Dr. Mark Cline. Here talking about allergy season. They are seeing a few patients a little bit more higher than compared to prior years. So Dr. Cline, tell us about how busy y'all's office has been with this allergy season.
Yeah, every year is a bad year in Nacogdoches for allergies. It's just kind of the allergy capital of the world. This year is a little worse. We tend to see this correlation when there's more moisture, more rain, which we've had through the winter and more recently. So there's more moisture in the ground, fosters more pollen counts, more pollen, and it's really the level of pollen counts, which is a number that's published every day. You maybe see it on your weather station, etc. Those pollen counts are the real thing that if they get high enough for a person that's allergic to a particular allergen, that tends to determine whether they'll be symptomatic or not. Some people are very sensitive at low counts. Other people, it takes a bit more for them to actually exceed a clinical threshold where they'll start actually having all the symptoms that people are trying to get relief from.
And what are those common allergies that we see here in DB's, Texas?
Yeah, that's a great question. And every region is a little bit different, right? So here through the winter, it's somewhat seasonal. Through the winter, it's a lot of the different oaks, the hardwoods that are in East Texas. Cedar is a problem for many people. It's just that we don't have as much cedar as Central Texas does. But for those who have trouble with it and are sensitive, it's really a problem this time of year. As we move into the spring, it's by far and away, it's the grasses and the weeds, okay? Because they cast their pollen for miles and miles. You can't really avoid it. And then as we move into the summer, we tend to see some relief, but after the dry season, when we get into the fall, most people can tell you what they're allergic to in the fall. It's ragweed.
Gotcha.
Not exclusively, but that's the number one by far.
All right. So explain to us the device that you have in hand, what you guys would be using it for.
Sure. This is a little prop I brought today. This is called a pinprick tester. You can see it's real tiny, no needles, okay? But the way that you test for the allergens that we are concerned that you might be allergic to is that we expose the forearm and we actually touch this little device to your skin, okay? You can feel it, but it's not painful. So no shots in the back, etc., what was traditionally called skin testing. But this, if you're allergic to the component in each little pin, okay, you'll actually have a response on your skin, in the form of a small wheel. And that's how we tell, depending on how big it is, what you're allergic to in particular.
Gotcha. And then we also mentioned, some people can't tell the difference between a cold and an allergy. Explain to those symptoms and what they should be looking out for.
That's a real common concern. It's very common for patients to ask us, I'm not sure if this is cold or allergies. So colds are more situational in many cases, and it can be hard to tell, but more often there's maybe more systemic, I don't feel good. It can happen in allergies too, but colds more common. Maybe low-grade fever. More often than not, their mucus may be a little bit colored or cloudy, if not outright green or yellow. In allergies, mucus tends to be more clear. Allergies tend to involve the eyes more than cold infections do, right? So if you're getting a lot of eye symptoms, that's almost certainly allergies. Most people have already know what they're allergic to, and they know, hey, this is typical of my allergies. So oftentimes it's pretty straightforward for us to give them guidance on what it is. The other thing is if it is a cold, we're able to tell them, hey, this should be getting better within a few days, whereas allergies might persist on beyond.